MRI with contrast is a standard diagnostic tool relied on millions of times annually. But in a crisis, a survey showed only 41% of radiologists knew the correct epinephrine dose. The failure isn't just in emergencies. Records often fail to name the specific contrast agent used. These information gaps create unacceptable risks. Patient safety depends on strong protocols. Here, we'll break down the risks, expose the system failures, and detail the new protocols to close these gaps. So just how widespread is this problem? Let's look at the actual data. Severe, life-threatening reactions are rare, under 0.01%, but they demand immediate, correct action. In contrast, mild reactions like hives or nausea are far more frequent, affecting up to 2.4% of patients. The danger doesn't always pass quickly. Delayed reactions can manifest hours or even days after the scan. A prior reaction is a significant warning. These patients have an average 15% recurrence rate, making past records vital. This spectrum of reactions brings up a fundamental question. What makes these contrast agents inherently risky? The answer is found in their chemical makeup. The active ingredient is gadolinium, a heavy metal. In its free, unbound ionic form, it is highly toxic to the body. While toxicity is linked to unbound ions, acute hypersensitivity is usually a reaction to the specific chelated molecule structure. This is why distinguishing a true allergic-like reaction from a physiologic one, like a fainting spell, is the first step in proper management. Another risk isn't a biological reaction, but a leak. Extravasation is when the contrast agent is injected into tissue instead of the vein. Protocol requires the injection to be stopped instantly. The limb must be assessed for swelling, pain, and damage to circulation. We see the individual risks, but where do our systems fail when these events actually happen? The failure is most acute in a crisis, with nearly 60% of radiologists surveyed not knowing the correct epinephrine details. The first defense is weak. The failure also occurs silently in the patient record. When the specific agent isn't documented, we are unprepared for a patient's next scan. Standardized documentation must include the exact agent, symptom profile, and every treatment provided to ensure audit readiness. This absence of good data and preparation turns a manageable risk into a potential disaster. It's a cycle of bad information breeding bad outcomes. If a past reaction predicts a future one, why not just pre-medicate all at-risk patients? The latest guidance shows this is the wrong approach. Here is a significant update. The ACR no longer suggests routine pre-medication for patients with a history of only mild, immediate reactions. The preferred alternative for these patients is not pre-medication. Instead, the guidance is to switch to a different class of contrast agent if possible. However, for a patient with a history of a severe reaction, pre-medication is still strongly advised if a contrast study is absolutely needed. This complexity shows that universal protocols are outdated and dangerous. What does a modern, effective safety system require? Let's assemble the facts. A toxic core agent, a 15% recurrence risk, and proven gaps in emergency knowledge. This combination demands a systems-level defense. The first pillar is a specialized, hands-on simulation to build the muscle memory required for industry-standard emergency response. The second is a multidisciplinary method. Radiologists, technologists, nurses, and pharmacists must work jointly to develop and update reaction protocols. Third, the environment must be prepared. This means fully stocked, regularly checked reaction kits and life support equipment where contrast is administered. So the solution isn't a simple pre-medicate or not rule. It is to build a full safety system based on current evidence, training, and teamwork. Effective contrast reaction management is not accidental. It is the direct result of following clear protocols and maintaining thorough documentation. These guides provide the specialized framework needed to translate evolving standards into actionable safety steps. Now is the time to review your institution's protocols, invest in simulation training, and commit to flawless documentation. A life may depend on the preparations you make today.